There we go. The delightful sign. So as I said, yes, Jenny Milne here. And if you're new to cafes, then it's usually that you have to bring a bit of coffee and cake with you. So I'm sharing with you on my screen some delightful things that my son made the other day, which were little gingerbread houses, and he decided to make them into garages. So I don't know who's got the cake, but I suspect Charles might have the cake because he told me he was going to be bringing cake. What have you got there, Charles? Unmute yourself.
It is, right? Just I love them. It's the most simple cake you can find. It's iced bun, right? I love them. I won't hear anything against them. They're brilliant. It's just a bit of icing on a bit of bread, isn't it? But I love it. It's great.
I like the iced buns that you get with the jam in the middle. They're even better.
Oh yeah, yeah. And sometimes with a flake on top as well, just to top it off. It's great.
I haven't had one of those before. Where'd you
get
those?
Yeah. I think it might be Welsh. I haven't had one until I moved to Wales.
Oh, well, I have to send one in the post. Anybody else got some cake with them this morning or not? Or a healthy piece of apple as I scroll through? Oh, you got banana, Alistair. Well done. Made you look like you were smiling as well. Are you smiling with it? Patrick, what did you have there? Sorry, I missed you. I have to flick through. An apple, and Craig's got a custard cream. Oh gosh, I'm the gingerbread queen then this morning. Anyway, without further ado, we'll talk about health things, and obviously we're being quite unhealthy eating sugary snacks at quarter to 11, whatever it is on Friday morning. But today's purpose is about rural and health. We are, as always, thinking very positively. The chat box is your friend, so please share your ideas and things in the chat box, and there'll be quite a few links sent through. I know a few of you are new, so as usual, I'll put a few slides up about SRITC. We've now been going as a social enterprise for just over 2 years, but started in 2018. And obviously it's about bringing people together, whether you're in a community, whether you're a transport provider, a technology solution in government. And really, the train journey's been quite a busy one recently. I see we've got Martin just joining us now from Germany. Our group of community is far and wide, and I think you'll see that at the gathering as well, as we have people from Sweden and Martin from Germany coming through. So it's all about representing different people's transport needs and sharing knowledge. And this morning we've got 4 people that are going to share some fantastic knowledge with you. But just in case you haven't seen faces to names, the 4 people in front of you there are the directors of SRITC. Obviously, SRITC is not their main day job, and we all have other day jobs, so you may recognise them in other capacities. And as I mentioned earlier, we've definitely got Jim on the call at the moment. This is our newly appointed advisory board from January that are helping strategise and look at the future of SRITC. Many of them will be at the gathering. And then we've also got a number of these here. Musketeers are friends that help out in the background to make SRITC what it is, including our supporters. So just a bit of a quick recap on what we've been doing since some of you saw us in February. The main focus really has been on one of the big asks that we had for government. We had 6 big asks, and one of them related to STEM and sustainable transport. And during that time, we've been running some STEM surveys, and they're designed for young people, and they're also designed for parents like myself, or an aunt or an uncle. So I know the team will put them in the chat box for you if you could fill them in or share them around, because the project is coming to a close. It'd be really useful to get some more data on that. We ran a workshop last week bringing together lots of STEM stakeholders, which are great chats. And I have to say, normally when I run a workshop, I come away buzzing. Well, I came away buzzing with an absolute sore head, because there was so much shared and so much knowledge there. And I'm sure the team would agree with me. There's a lot to process. So watch this space as the project concludes in the next couple of weeks. And as you'll probably have read in one of the news bulletins, one of the team went up to Orkney as well. So a lot going on, and behind the scenes we're also starting to review our website and look and see what we want the website to be and what its purpose is. So if they've got any comments on the website, please do put them in the chat, because it will help us. And obviously somebody will tell me it's 42 days or 41 days, but my brain's a bit pickled today, until the gathering in person and online. So you can imagine that's taking up quite a lot of our time behind the scenes. So I don't think that's bad for a team that's all part-time over the last month. So I'm now going to stop talking, and I'm going to let Charles introduce himself. And I'm very grateful for Charles coming along today. And then he's going to hand over to Rhianne, who's going to hand over to Ruari, who's then going to hand over to Caroline. So it's a great train journey. So sit back, relax, and Charles, over to you.
Right. Hi, everyone. Thank you so much for having me come to your cafe. and delighted that I can bring cake with me. It's brilliant. My name's Charles Musselwhite. So I'm a professor at Aberystwyth University in West Wales. It's nice and rural around the edge of us, which brings with it both beauty and difficulty, particularly when we're thinking about transport. I'm going to give a bit of a presentation this morning because I'm an academic. We have to do that kind of thing. We can't not give you a presentation, but I'm going to whiz through it as quick as I can because I want this to be more of an interactive thing, and like it normally is, rather than just me talking at you. So if there's anything on there you want more detail for or about, then just contact me afterwards. The slides I think we're going to share anyway. So I think without further ado, I'll try and share my screen and put that onto. There you are. Can you all see that okay? Just nod.
Yep.
Yeah, lovely. Thank you, everyone. Thank you. Thank you. So my background is psychology. I'm in a psychology department, and I've spent the last 25 years, I know I don't look like I could possibly have spent the last 25 years looking at transport, but I have. And I look at it from a social perspective and the sort of psychological perspective. So very people-based element to it. And really over the last 25 years or so, it's come to light that that brings with it the idea that transport and health have to be linked. People's health is definitely linked to the way we're mobile and how we get out and about. And you can't look at the two in isolation. You know, it's not just about access to healthcare, which of course is really important, but it's also the health elements that are related to transport as well. So what I've set up at Aberystwyth, and anyone can join this, so you go to the website and join and get involved, is a transport and health research network. We've got some funding from the Welsh Government to get this off the ground, and I'm doing it with Public Health Wales, so it's not just an academic endeavour. And as I'll talk through and show you what the kind of things we do with some examples, and then end up with some rural psychology involved or related to transport as well, you'll see that lots of what we do is probably not dissimilar to how you run things there in this group even. What we've absolutely found out is that we've got to start small but detailed. So lots of our work is very community focused, to get people together, to get people thinking about their transport issues and working together to co-produce and come up with solutions for the transport in their own community, in their own areas. And then we'll try and upscale that and learn from that and see how we can take that forward. So I'd be very happy if any of you want to get involved in that. So like I said, it's transport and health that we bring together in our THINK network, the Transport and Health Integrated Research Network. And we look at those four key things because they're where transport or being mobile really affects people's health, in terms of active travel, in terms of road traffic casualties and injuries, in terms of pollution, and in terms of what we talk about, community severance. Transport can make or break communities, as I'm sure you're aware. And, you know, even on that picture we've got there on community severance of the M4 going through the middle of Port Talbot in South Wales, you can see how it literally cuts that community in half, while also perhaps joining together different communities from it. But there's been a lack of research about how that affects people's well-being, how that affects people's health, and how that's really related to creating community or severing community. And we need a little bit more research on that element. But certainly the other elements are really important in terms of transport and health. We do our work around three main topic areas within those four key themes that we look at. We've got a Think Foundry where we're starting out trying to, and this is where the co-production sort of begins. So we're getting together people interested in transport health. So we have public health practitioners, we have health boards, we have people from communities themselves, and we have people from transport planning, and we try and get them together. And sometimes they understand each other, but not always. So we've got to bring that together. And that's where lots of our work is, trying to create opportunities to bring people together, and opportunities therefore to enrich their skills and give them space and time to work together. And we do that through the Think Academy, so producing things like summaries and blogs, but also as I'll show in a minute, we've spent some money out on some community mini projects, and we want to do some more of that. We want to put practitioners who work out in policy and practice to work with us in academia, and we want some academics who are researchers doing stuff on transport and health to go and work in policy and practice and really bring that multi-sectoral work together. And then we hopefully can develop new research, new knowledge exchange, and develop impact. We don't want our research sat on dusty shelves. We want it to have real life impact. Just to go through quickly what we've done in terms of, we started with some agenda setting workshops, so it wasn't all about what we think are the priorities. We got our stakeholders to get involved in that, and it involved some really pretty and nice post-it notes which we did online and grouped them together, and they came out with things again that won't be news to any of you working in community-based stuff, but it's about having more equitable, inclusive solutions to transport, about opportunities for people to collaborate and improving collaboration, looking for more evidence and how we bring that across in a more palatable kind of way rather than keeping it very scientific and impenetrable, and identifying more opportunities for working together and bringing people together to develop that evidence. And we have communities of practice moving forwards to work on that, and anyone again can get involved in these communities of practice at any time. They're mostly meeting online at the moment, but we have facilities to bring people together in person if we can in certain places. The Think Academy, like I said, that's our traditional things about seminars, conferences, summaries and blogs. We've got a new podcast series about community transport that's just been launched, and you can find that on the website. That was supposed to be just a 30-minute long podcast. I think it's turned into 5 almost hour-long podcast because we had so much rich and amazing information from the people we worked with in the communities and the transport community transport providers, and loads of the issues came out, and we really didn't, to do it justice, we had to create them around some key themes instead of just drawing a 30-minute version of it. Like I said, we've got money to give out to people, really not very much, nowhere near as much as I'd like. It's £2,000 for a small project, and we call those around certain areas. And the first lot we did was transport in community health. So how does transport help people stay healthy in their communities? And we have 4 projects that we've given out here, 3 of them in Wales and 1 of them in Pakistan. We've left it open so anyone could apply across anywhere. Age Connects Morgana, so that's about older people connecting with their community. Social inclusion from Gemma, who's the director for Wales at Community Transport. That was about people with learning difficulties and the problems and issues that they have in connecting to the things they want to do. And both those projects, I think, was really important to just emphasize that they're not about going to hospitals, they're not about going to shops, they're not about serving people's boring but necessary needs. It was about getting them involved in things they might want to do in their community, fun things, leisure activities, and getting people together really at the end of the day. Then we've got one in Newtown that's about encouraging active travel, because again, that's vital for people's health. And Newtown it was really interesting because they have a formal way of drawing where active travel happens in Wales because of the active travel bill. You draw the routes as a map for walking and cycling in your community. And what they found in Newtown was that people didn't use those at all. People went on their own little journeys around the edge because they wanted to avoid areas they were worried about, or they knew that area actually was far too muddy to walk on those particular days. Lots of particular sort of individual subjective reasons. So they're redrawing the maps and encouraging active travel through that way. And our international project, really interesting, about supporting young women's mobility through mobility by giving out and assessing how well this goes. Scooties, which are scooters at the end of the day, and hopefully e-scooters is the way we're moving on that project as well. But in the first instance, just some ordinary scooters. Again, lots of issues about being excluded from communities because of the gender and background that they're from, and some areas much worse than others, meaning that they just couldn't do the things they wanted to do without that kind of thing. So really interesting. We've got projects on the go. So we've got one in the UK looking at gender exclusion on buses and how we encourage people to feel more safe on buses. We're supporting the rollout of 20 mph as a default speed limit in Wales through research with communities, with business, to find out their issues, concerns, and how they might be addressed before the 20 mph default speed limit in residential areas is deployed in September later this year. And one of the areas we look at is rural transport and health. So I'm just going to go through that for 5 minutes now. So we really wanted to look at the issues because we've done this very much from a community point of view, and we're in Aberystwyth. Lots of the people we talked about being really excluded, really isolated, not being able to connect to the things they want to do as well as they could, just because of where they lived in rural areas. We've got lots of stuff with public buses not having their contracts renewed, or not public bus companies not wanting to take the contracts on moving forwards. If you haven't got a car, you're really, really isolated. And that came out from lots of stuff we do. And I think sometimes, again, people in urban areas tend to think that there's a rural idyll when it comes to mobility and transport. Everyone's cycling around on their bikes through fields of beauty, as you can see on the left-hand side. And actually, the reality is much more like on the right-hand side. So whether we're talking about, access to that nature, access to off-road places, it's really difficult to get there. So you end up with terrible traffic, lots of issues that are a lot worse than you think they're going to be because of a rural area. Trunk roads that get congested, areas of parking around nodes and honeypot areas that end up being very congested with poor parking. And you end up with people in rural areas having to travel much further to do the things they want to do and things they've got to do, as you can see there with the blue and the yellow. Take the same number of trips, but actually it takes them a lot longer and a lot more miles to do that. And they do that much more likely through having to own a vehicle. In rural areas, much less likely to have no car, much more likely to own 2 or more cars. So there's a necessity that's happening there that keeps people addicted to cars and having to use them. Lots of my research is around older people and aging. And again, in rural areas, that's a particular issue, having to give up driving, much more difficult than it is in an urban area. There's issues in suburbs as well that need addressing. But again, that's the idea that you can cycle off-road, you'll be able to walk where you want to do. The rural idyll is out there for everyone to get involved with, but the reality is much more harsh and difficult. I mean, there are places like on the left-hand side, but it becomes much more difficult to access them because we've got through trunk roads with no provision for walking or cycling. And of course, that affects people's health. So unsurprisingly, perhaps for us, because we know this, but I think, again, people from urban areas often making the policy themselves, they're not thinking very much about these things because they think it must be beautiful out in rural areas. You can all walk and cycle where you want, but actually we have lower levels of walking in rural areas, really low levels of using the bus and railway. Not a surprise to us, but that makes a big difference in terms of transport equity and transport inclusion. And again, these figures here, for some reason, the font turns to green here for rural areas. Access to all the things we need to do in our community are much more harder, takes much longer in rural areas than it does in urban areas, whether you're walking or using public transport, and even by car, it's a lot longer for everything that you need to go to, particularly, I think, strikingly for hospitals and for GP. And again, for my research with older people, that's a real concern for them. So just a couple more slides talking about the challenges. Like I said, limited access to public transport. We've got accessibility to shop services and jobs and opportunities being much more difficult in rural areas. We're seeing more and more agglomeration of big business, of shops, even of hospitals at the edge of town or city centres, making it much more difficult if you don't live near them to not have to use a car. And making rural accessibility really difficult to do. So you've got this forced car ownership that really impacts on population. It impacts on all sorts of inequalities. It impacts very much on the health, as I said earlier, that air pollution, the collisions, the fatalities. And even though, again, there's this idea, I think, in urban areas that rural areas don't need to worry about air and noise pollution, they don't show up on the macro level statistics. But along some trunk roads, some of those nodes where traffic gets bunched up, often where the residential areas are as well, you end up with really high areas of air and noise pollution that really impact badly on some areas in rural and can be just as bad as urban areas. And that's got to be thought about. Road safety can be really bad. Lots of fast roads, again, limited infrastructure for cycling and walking, where you've got to share it with vehicles a lot of the time, again, with residential areas on it, really dangerous little nodes. But again, at a macro level, perhaps it doesn't show up, but we know from the community work just how dangerous those can be. And we're going to talk about it a bit today later on as well, isolation and loneliness being a big issue in rural areas because of the difficulty of getting from one community to the other. And like we said, fewer opportunities for walking and cycling, difficulties in exclusion beyond that, older people particularly, and again, a bit on gender, with women not feeling able to walk or cycle or use public transport because of dangers in the area, that kind of thing. And like I said, I think some of that comes from a lack of focus on rural areas. Lots of our strategies, our policies are very urban centric. They're designed by people in urban areas, and they're thrown into rural areas in the hope that they'll be exactly the same, whether that's sustainability policy, whether it's health policy. But we know things like the penalty of distance, the lower population density, sometimes the transient populations mean that we've got a qualitatively different population or different community to deal with here, and the urban policies, the urban interventions and urban solutions don't fit very well in those areas, and we've got to think differently about doing them. But I'm going to finish with this, that I do think there's real opportunity. When I've worked in rural communities, there's a real, perhaps out of necessity a bit, but the kind of people there mean that we've got what we call in the business really high social capital. There's a big will or motivation to make things better. And I think we've got to build on that a little bit. That's where co-production or co-designing needs to come into. We need to think about how we support people's mobility from a bottom-up or grassroots kind of thing. There's the will there. There's some really innovative, clever solutions happening, and we've just got to support those a little bit better. There's some really good examples. Again, in Scotland, you've got rural mobility as a service, as a kind of attempt with Go High Initiative and High Trans and Mobilio supporting that underneath. Why can't we take an urban solution but put it into a rural area, co-develop it with local people, trial it and adapt it in that action research kind of way, and really try and make a difference. But we've got to do that by bringing sectors together. There's real opportunities again to do that in rural areas because people want to make a difference. We can't rely on one sector to deliver mobility for us. It's not fair to leave it to community transport. It's not fair to leave it just to bus companies who need to make a profit. It's not fair to leave it to just health boards to consider their transport. We need to bring all of that together to make it work for us. And we just need a change in thinking about economic models that, again, are very urban centric. And we've got to think about costs and social return on investment a lot more. And again, in Wales, we've got some progressive policy that just needs to be tweaked or adapted a little bit, like the Future Generations Act, for example, which stopped the M4 being rebuilt and turned around the Newport Centre, has lots of impact again on urban areas, but we need to think about how we use that better in rural areas. So using some of the skills and the techniques we've got, and that's where I finish. Sorry, I could go on for hours about this. I've probably gone on too much, but do get involved if you want to, and do get involved with the stuff that we're thinking about. And it'd be great to learn about some of the things that you've been doing. I mean, Jenny's told me some things, but it'd be great to know some more. So that's where I finish for now. So I'll stop sharing my screen, and I'm delighted to hand over to Rhianne, who's going to take some of the stuff forwards about the work she's been doing with younger people and helping them to stay connected together, where again, distance can be an issue. So over to you, Rhianne.
You need to unmute, Rhianne.
I work on time. So my name's Rhianne Forrest, and I work for a charity called Children's Health Scotland. We're the leading children's health charity in Scotland. And we work with young people aged 9 to 17 who are living with a long-term health condition in Scotland. And I'm here today to talk to you about our self-management skills programs, also known as SMS. So mainly here to talk about SMS Connect, because that's our online one, and anyone across Scotland can join it. So I'm just going to play a little video because that does explain it very well, and some of our young people speak in that video to say why they like our programme, and then they'll come back and have a wee chat. So,
SMS Connect is an online group programme for children and young people with health conditions from Children's Health Scotland. Designed with the help of young people, SMS Connect will support you to build your confidence, encourage you to try new ways to manage your health and well-being, and give you opportunities to meet other children and young people who experience similar challenges. When you join SMS Connect, you'll meet a group of up to 12 children or young people around your age who also have a health condition, as well as our friendly coaches who will support you throughout the 6-week programme. You will receive a home pack with your own login to our safe and secure online platform. Your coach will arrange a video call with you to tell you all about the programme and explain how to use the platform. This platform will allow you to safely join group video calls, take part in discussion boards, and send private messages to your coach and other people in your group. We will meet twice a week for fun games and activities, and to discuss health and wellbeing topics such as sleep, healthcare rights, managing stress and anxiety, and looking after ourselves. We will encourage you to develop your digital skills by working on a digital story about something that is important to you. When you have finished SMS Connect, you will be invited to join the SMS Hub, an online community where we can stay in touch and attend fun monthly sessions.
Hi, my name is Rona and I'm a part of SMS Connect. When I first joined the group, I was really quite nervous, but as the weeks went on, I became more comfortable with the people around me and started having a good time.
Joining SMS Connect made me realize that I'm not as alone as I thought I was, and I highly recommend it to anybody who wants to try it out. It may seem scary at first, but everybody is really, really friendly, and I met my best friend on there.
If you would like to join SMS Connect, I would say go for it. Thank you.
SMS Connect will help you learn self-management skills to improve your health and well-being, meet other children and young people, and most importantly, have fun. Go to childrenshealthscotland.org to find out more.
So that's just a wee video that's quite good at describing what SMS Connect is, because when you first try and describe what we do, a lot of people can be like, I'm unsure. So this is our website, so I can put the link to this in the chat if anyone wants to have a little look in their own time. And it's also got our online referral form. So if a child or young person wants to sign up, they can self-refer and they can do it through the online form. So what SMS Connect is it allows children who are maybe isolated, that could be due to their health condition, maybe they can't get out and about, maybe they live in a rural community where transport is a struggle for them, and it means that they can attend our programme and they don't have to rely on a car or a parent taking them. And it's great because we all connect online and we all work together, so they'll get a home pack in the post, which comes in a big purple bag, and it has all the stuff they'll need for the programme, and it's completely free. So our programme's completely free, and they get ongoing support from us. And I'm going to show you our digital bricks platform because I think that's quite good to show. So the way they join Connect is through our safe and secure online platform, which is called Digital Bricks. The reason for this is safeguarding purposes. We have complete control of this platform. We know who's on it. We know who's on their programme, and it means that they can connect with each other via private messages and it not have to exchange any personal details. So they log in and they look something like this. So this says hello Rhianne, because this is mine. And they go to something called my courses. They don't see as much as this, but say I'm a 9 to 12-year-old who's joining Connect for the first time, they will see SMS Connect 9 to 12, and then they'll click on that. And it takes them to this platform. There's lots of things on this platform. We are rejigging it and working on it a bit to make it a bit more the style we would like. But currently they've got resources, which has a bunch of the resources we learned. They've got all about their digital stories, and then they've got their group sessions. So that's how they log on through Zoom. They click on this, and then they click on these links, and that takes them straight to their Zoom lessons. So it means that the child or young person can log on independently. They don't have to rely on a parent or guardian getting them all set up in Zoom. It should be done for them. So this is just all about their health. We say they do have to have a health condition, but it doesn't have to be formally diagnosed. And there's lots of different things that we can do with them. So that's just a bit about what we do. So please, I'll put our website in the chat box, and if anyone wants to share the link, share it among people who they think would be interested, please feel free to do so. So that's all from me. So I will pass on to Ruari and let him discuss what he's here to talk about.
Thanks, Rhianne. Hello, everyone. Yeah, my name's Ruari. I work for Developing Mountain Biking in Scotland. So I cover the Highlands, and I work to kind of make mountain biking more successful, really. So working to develop new trails, new facilities. Some of them are sort of urban pump tracks and bike parks. Other ones are sort of like more mountain bike trails in rural areas. I work with communities, getting them more active around trail maintenance, work with businesses to try and make mountain biking and cycling work better for them, work with destinations to make mountain biking more attractive to visitors coming into destinations. But I'm here to talk about a wee kind of side project that has sort of quietly evolved, and it's a nice wee step on from what Rhianne was talking about. So I've been supporting a group in Fort William developing a new community bike park. It's an amazing project, £600,000 urban bike park that's going to be based next to the high school in Fort William. That'll have a pump track, skate BMX park and a trials area, and then through that they're planning to build a bike maintenance workshop that'll host the local environmental group will be based there, and they'll have a member of staff there that can do bike maintenance workshops and do coaching out of, and it'll be that kind of facility that can bring in different groups. So in the process of planning that, I was going out to talking to lots of the sort of like various stakeholders and supporters, and got talking to Highland Council Children's Services about how they could potentially use the facility for their different projects that they're working on. And really what I'm here to talk about today is an example of how cycling and working within communities, these partnerships and opportunities come up, and they're kind of unexpected. So I don't have any presentations. What I've been doing is kind of evolved as a kind of wee side project of my main job. We've just kind of been learning on the go. It's all been quite informal, and I can't really share any of the information because of this sort of confidentiality around the young people I've been working with. But yeah, so through developing bike in Scotland, we've been part of this is a kind of long story to get to where I'm going. We've been part of an inter-European trail project around increasing the competency of trail builders and groups working in trail maintenance. And in Scotland, we've got a kind of growing culture of volunteer trail maintenance. So local community trail associations forming to get land manager permission to maintain their local sort of unauthorized informal trail networks. So not the kind of like purpose-built trail centres, but the kind of community developed stuff that's been built up around communities by members of the community. So people going out and just like building their own trails in the woods. So it's really exciting, it's really great. I support probably 8 different trail associations across Highland. So as I was kind of explaining this to the Highland Council Children's Services worker, she was like, well, we could use that course. So the course is kind of, it's to increase the competency of these groups. And I was kind of describing it to her and she was like, could you do something like that for young people? So we chatted around the ideas and we kind of decided, yeah, we probably could make that work. So when coming out of summer last year, we kind of set up a 12-week pilot to work one-to-one with a young person who wasn't attending school, had really low self-confidence, and didn't quite know where they were going in life and how they were going to move on from the kind of tricky situation they found themselves in, where they were, at school, weren't really leaving the house, didn't really have sort of social networks. So we built up this 12-week program that was built around the course, which normally runs over 2 days. We stretched it out over 2 weeks and just broke it down into very small, manageable sections. It was very structured. So we were looking at trail inspection, creating trail maintenance plans. We had a mini pre-commencement meeting with the land manager. Forrest and Land Scotland were really good at kind of supporting us, gave us permission to use the land, and also kind of like came along and were part of that process of like letting the young person meet somebody in a kind of position of authority, and so they had to explain their plans and get approval. So that was really nice. From that, we went on to like clearing the trail corridor, which is all the kind of trees or vegetation around the trail, everything around the trail, doing water management, doing trail tread, which is the actual line, the surface of the trail, and then junction management, so sort of the interaction between the trail and other trails. So where it popped out was onto a kind of busier multi-use trail, so working out how we could do that more safely. So that was really nice. The young person really enjoyed getting outside. We took loads of time to explain the different concepts, and he just grasped it really quickly, and just kind of went with it. So we just got more and more ambitious with what we were getting him to do. So at the end of it, sort of built up a folder of evidence. So there was a report on the maintenance, photos, quotes and key moments. So the young person and his key workers could then use that as a sort of reference to dip into, so then they can go for different awards. So the young person kind of got one sort of youth award through it, but what they were saying was the quality of the work he was doing was enough to get the gold award, but the hours he was putting in wasn't even enough for the bronze award. So we kind of padded out the hours to bring him up to bronze award level, but also he's got that kind of in the bag now. So as he develops, he can work up silver and gold to get those awards. So it's like, I think it was really good for the young person just to hear that, you know, like he wasn't in school, didn't have any kind of, you know, qualifications, but he was coming out of this told, actually you're at gold level here, you're just not putting in enough hours to get it. We also had it verified by the SQA, Scottish Qualifications Authority, so the actual work he was doing did, you know, carry some formal educational credits. And the end result was really successful. He went from 17% attendance at school back up to 100%, just kind of got like so much more confidence. It's like he realized he could do stuff and he could, you know, communicate with adults. He could, like, you know, he could explain what he was wanting to do, and he just really enjoyed being out and working. So that got him thinking, right, okay, what can I do? Like, what would I like to do with my life? And he you know, after that, he was like, I really like to actually just work outdoors. So that was just like a wee moment, I think, where he thought, right, there is something I really enjoy, and here can I, you know, here's a way I can do it. So as a follow-on from that, the council came back sort of saying, right, can we do this again, but can we work again with that young person, but take him on as an assistant leader, and bring in some new young people. So we're doing it again over a 3-month period, but it's very different dynamic this year because we've got the young people, they're younger, like much younger than the previous one. So, you know, limited attention spans. They've been getting into loads of bother at school. You know, they're just not really, they're in and out of school. But we're using that as a kind of way for the young person that came through first to kind of develop some leadership skills. He's in as an assistant leader to help me. And then, so it's a lot of thinking on our feet. So yeah, I mean, that's kind of what it's been all about. I don't want to talk any more about it because, like I say, it's a side project I've been doing off the side of my main job, but it's been really rewarding. And I think the tie into what Rhianne's been talking about, and then just getting people on their bikes and kind of making that part of like their normal routine, and hopefully building that into the culture that, you know, they can have this escape from their normal lives by going out and being creative, being busy, building things in the outdoors, being active. So it'll be really interesting to see where it goes. So that's it from me now. So I'd like to hand on to Carolyn.
Wonderful, thank you, Rory. What a powerful story, and what a difference that's made in that young person's life. Well, wonderful. Thank you, Jenny, as well, for inviting me along today. So I run a smart home technology company called TL Tech, and over the last few years, we've been on quite a journey because of COVID. So our business originally focused mainly on hardware and supporting people to adopt new technologies, and was a much more traditional business model. And when the COVID pandemic hit, we ended up completely changing what we did and starting to try and remotely support people. So a lot of the work that we do with the smart tech is actually with voice assistants, and we use them because they're so accessible and they have a lot of inbuilt features and functionalities that are really helpful. So we ended up starting to develop our own voice applications, and that has led us on quite a journey. So what I actually wanted to talk to you about today was a collaborative project that we've been doing for the last 6-7 months roughly, with the Alliance, so the Health and Social Care Alliance. And if you weren't aware of it, the Health and Social Care Alliance, they have a service called Alice, which is their local information system for Scotland. I have a little prop, I don't know if you'll be able to see it. So Alice is a website, it's a directory, and I'll pop a link to it in the chat as well so that you've got it. So Alice's website has lots of different pieces of support information. So it allows you to find out what's happening in your local community. There's lots of different groups for all different ages, all different walks of life, different health conditions, quite specific guidance around more recent things that people obviously are struggling with, the cost of living, and these sorts of issues. And so over the last wee while, we have translated or created a new way of people being able to access Alice. So on Alexa now, you can say, and maybe if you've got your Alexas, I should talk more quietly. Apologies if I've set anyone's thing off. You just say, enable my Scottish community. And then you can go in and you can search for different support services. So whether that's walking groups, cycling groups, anything like that that you can think of, and it will do a customized search for you. If you grant permissions, then it can also look at your location based on your Amazon account information, and then give you things that are even more tailored. Part of this process, or it's been a really interesting process for me, because we did a lot of co-design workshops and activities to find out what was important to people. And interestingly, one of the top things that was discussed was the location and how accessible it was, and how would people get to the places that they wanted to go to, and was it on a bus route, and lots of questions came up around those sorts of areas. So unfortunately, at the moment, this basic version that we have isn't able to accommodate answering those sorts of questions, but we are very keen to understand how we might go about creating something that did have that information, because we know how important it is for people, and particularly in Scotland, with our geography and the way that communities are located. It doesn't make sense for us to have a database that yes, on paper, you're giving people information, but if they're not actually able to access it because of transport and things, then it doesn't. We want to be more joined up, I think, is what we've kind of heard from people. One of the other things that we got in terms of feedback was people wanting to understand more about when things were happening, so the timing. And again, I think that also kind of links in with the transport. So if a group is on in the afternoon, is there actually transport in the afternoon? Jenny and I have an ongoing saga with our bus travel, and the other buses are, the new times that have been proposed are not useful for anything. Basically, you'd have to spend all day in the nearest town, even if you wanted to just go to one activity. So my ask, I guess, to you is, it would be wonderful if you could try out the My Scottish Community app. And if you've got any feedback, that would be wonderful. The link that I'm going to pop in the chat, there is actually a little comment box towards the bottom. And if anyone's interested, we are going to be running some more focus groups and co-design sessions to look at some of these other features. So in terms of how would we design a conversation that helps to give that information, and what kind of format should that be in when it comes to transportation and travel directions?
Thank you, Caroline. I know we've done more chatting because we've had 4 people today than normal, but I think it's really important to cover the diversity that's out there. And as Charles said, I think before we came live, it really is about how digital seems to have really taken up a force. I mean, there you've got Rhianne doing digital, but then you've got Ruari doing the practical in-person piece as well, and then Caroline online. So it's really interesting how when you talk about health and transport, we haven't even talked about patient transport and NHS and things like that, which is another cafe in itself.